Senate Bill 159, 680 with amendments 287, 328, 387, 501, 600,
Second reading will be deemed completed. Under Governor's Appointments, Senator De Leon, file item 15. Senator De Leon.
Thank you, Madam President. Colleagues, we have Alicia A. Griffin, who is an appointee for the position of Director of the Department of Child Support Services. She was heard in the Rules Committee on April 22nd and approved on a bipartisan vote 5-0. Ms. Griffin has over 17 years of experience working on child support services and is considered a nationally renowned leader in this area. Most recently, she led the state of New Jersey in designing and implementing a child support automated system that is considered one of the most successful in the health and human services. Very impressive woman, very qualified. Madam President, I respectfully ask for an aye vote.
Thank you, Senator. Is there any debate or discussion on this appointment? Seeing and hearing none, is there any objection to substituting our unanimous roll call? Seeing and hearing none, ayes 38, no 0. That appointment is confirmed. File item 19, Senator De Leon.
Thank you, Madam President. These appointments before us are for the position of members of the California Water Commission. We have Mr. Andrew J. Ball, Joseph B. Byrne, Daniel Curtin, Joe Del Bosque, as well as Armando Quintero. These appointments were heard also in the Rules Committee on May 6th, approved on bipartisan vote, 5-0. Mr. Andrew Ball is the president of the Western Region of Suffolk Construction. Joseph Byrne is an attorney with the Los Angeles law firm Bess and Krieger. Daniel Curtin is the director of the California Conference of Carpenters. And Joe Del Bosque is president and CEO of a family-owned farming company in the Central Valley. And lastly, Armando Quintero is the director of development at the UC Merced's Sierra Nevada Research Institute. Each of these individuals bring different perspectives, different parts of the state of California. Obviously, how we improve our water system is very critical. Madam President, I respectfully ask for an aye vote.
Thank you, Senator De Leon. Any debate or discussion on this set of appointments? Seeing and hearing none, is there any objection to substituting a unanimous roll call? Seeing and hearing none, ayes 38, no 0. Those appointments are confirmed. Members, we will go to Senate third reading, and without objection, we will move to file item number 67, which is Senate Bill 277. Mr. Secretary, please read.
Senate Bill 277 by Senator Pan and Allen, and echoing to public health.
Senator Pan.
So thank you, Madam President, members. Actually, what I'd like to do is, if it's with your permission, to have Senator Allen open. I will take questions and close.
Very good. Thank you very much, Senator Pan. Senator Allen, you may open.
Thank you, Senator, and thank you, Madam Chair and members. SB 277 is about increasing our immunization rates so that no one will have to suffer from vaccine-preventable diseases. Now, as many of you know, I come to this story both as a school board member who saw the vaccination rates lowering in my district, and also as the son of a childhood victim of polio, who received polio, got sick from polio as a young boy right before the vaccine became available, and saw a great deal of suffering in his life as a result of that contagious disease. And I think people in his generation still can't believe that we have allowed communicable diseases that we have the tools to fight back into American society. This bill is inspired by that story, inspired by the suffering that so many have gone through in the past in the United States. It's also inspired by the fact that California sits at a global crossroads. We are a center of intake and outtake, of trade, of tourism, of movement. And unless we want to shut down our international airports, we have to recognize the fact that there are dangers out there. 400 people die of the measles every single day in other parts of the world. This bill has, of course, inspired review, scrutiny, analysis of 3 policy committees to reach this floor. The Senate Health Committee analyzed the implications on public health, of course. We heard from doctors, from chiropractors, naturalists, acupuncturists, medical students, clinical providers, hospitals, healthcare plans, medical professors, pharmacists, the United States Surgeon General, and the former U.S. Surgeon General. In the Senate Education Committee, we heard from school administrators, teachers, the PTA, school children, charter schools, county boards, school boards, cities and counties, supervisors, home schools, and private schools. Then we went to the Judiciary Committee, analyzed the bill to the tune of a 27-page analysis, an excellent and interesting jurisprudential study with legal scholars from all across the country testifying in committee. We heard from the Dean of the University of California at Irvine's Law School. This bill is essentially about answering the call of parents and believe the silent majority who supports vaccines and wants the assurance that their child's school has high immunization rates or community immunity, that there's protection when they send their kid to school. One child who is not immunized isn't a big deal, but more and more children not receiving vaccines allow for the potential spread of diseases and increases the number of exposures that someone has of catching a disease, increases the chance of catching a disease. If this bill were really about personal choice, we wouldn't be here. This is about how each of our personal choices impact others. It's the personal choice that someone might make that might end up making someone else sick. This bill, of course, has inspired editorials. We've got the support of nearly every editorial board in the state. It's inspired calls and visits, conversations that you and your staff have taken. And for that time and consideration and for the engagement of the public and for the countless hours that I know each and every one of you have spent and your staff have spent, I know that Senator Pan and I are very grateful and thank you. But we didn't introduce this bill to create long lines in the Capitol, to create business for the deli upstairs, or to be assured that civic participation is alive and well in California. We introduced this legislation because both of us have seen the harms of vaccine-preventable diseases. Dr. Pan is a medical intern, myself as a son. These experiences have culminated in this moment, and in which I hope that we embrace our responsibility in making every school in this state safer. So for those reasons, I ask for your aye vote and look forward to the discussion. Thank you.
Thank you, Senator Allen. Senator Huff.
Thank you, Madam President and members. Since this bill was triple referred, there's very few of us in here that haven't heard a robust discussion on it already. And I don't know that we could quite duplicate that on the floor anyway without all the testimony, both for and against. And so it's one of those issues that as we weigh it, we have to figure out, there's no right or wrong in this, but we have to figure out how do we vote a thorny issue. And as I look at this, I'm very sensitive to those who have immune systems who are compromised. And I recognize that our number one responsibility, I would say, is public safety. Public safety has many different hats that it wears, whether it's a police, like we recognized earlier on the floor, that do rescues in the mountains or other places, whether nationally it's our Army that protects our shores, our boundaries, or in our case, what we mandate or require of the public. This isn't a decision to be taken lightly, and I don't think any of us do, but for me, I'm still not convinced, and here's why. The recent outbreak at one of our amusement centers, without being specific, is what seemed to bring this to a boil. And in looking at that, you had 500 and some cases of measles that resulted. But as they drilled down on that and they looked at it, 20% of the people who got infected had already been inoculated. You have a lot of foreigners that visit here, and we don't require them to be inoculated before they come to our country. In fact, we thrive on visitors. We thrive on people coming to California because it's a great place to come and visit. So if you have a child, or if you as an adult have an immune system that's compromised, you would reasonably expect that if you took that child to a place, an amusement park, or even a school, that it's going to be a germ factory, that you're going to be at risk. And so if I had a child in that condition, I would not be taking them there because even though it's a remote chance that they would get sick, Certainly, you can protect them better at home or in a place that doesn't have as many potential problems. Additionally, to some of the vaccines wear off, you have some vaccines that also, like chickenpox, while it's remote, they're also contagious for a period of time. You could actually be spreading it by immunizing somebody for chickenpox and they're out in a public situation and they could catch that. That's what the disclaimers say. So, with all that being said, I do think that our vaccines are some of the greatest medical advances in the world that we have seen forever. And my family and I all get vaccinated. So it's not about whether I believe in it or not. It comes down to what do we as a society, do we as a legislature trade when we mandate that somebody has to do this to protect somebody else. And I don't believe that the crisis we have seen with the measles epidemic raises to that level to give up the personal freedoms that we enjoy in a free society, because there are complications for some, not for all, but some. But even if you have 0.5% that are affected by an inoculation, why do we mandate that they put their child at risk? Let the parents decide. Let us help educate them to the values of vaccines so they have a very informed decision. But I don't think it's our role here today to mandate that they have to take part in all these vaccinations. So I urge your no vote.
Thank you, Senator Huff. Senator Morell, now let me stop for a second. It's my understanding that we have 6 sets of hostile amendments, and you were going to present the first set, is that correct? All right, so colleagues, since the dissemination of the information, set 3 has been removed by Senator Anderson, and set 1 and 2 have been switched in order. So the first set of hostile amendments belongs to Senator Morell. And Senator, you would like to present at this point?
Yes, I would. Thank you.
All right, excuse me. In that case, Mr. Secretary, please read.
Amendments by Senator Morell, set 1.
Thank you. Senator Morell.
Thank you, Madam and President and fellow members. I rise today to amend SB 277 to protect those who have religious objections to state-mandated vaccinations. This amendment would grant a religious exemption if a parent signs under the penalty of perjury a statement of faith which says, "This vaccination violates my faith." Every individual's faith is personal. The First Amendment protects our ability to practice in each of our own ways. America, of course, was founded on the principle that one could worship without fear from government interference. However, this bill in its current form, SB 277, crosses that line on some of the most basic tenets of our religious freedom and that of individuals' faith-based decisions. Without an exemption, SB 277 undermines our Constitution and disregards our rights to faith as free citizens. It tells deeply devout families that the government thinks it knows better than their own faith traditions. In 2012, Governor Brown preserved religious exemptions to state vaccination requirements when he signed AB 2109. We should continue this policy. Please do not table this amendment and avoid a vote on religious freedom. This is too important an issue to ignore. Thank you very much.
Thank you, Senator Morell. Senator Monning.
Thank you, Madam President. I move to lay this proposed amendment on the table.
Thank you, Senator. This is not debatable. Mr. Secretary, please call the roll. Excuse me, Senator Monning is asking for an aye vote. Senator Morell is asking for a no vote. Mr. Secretary.
Allen? Aye. Anderson? No. Bates? No. Bell? Aye. Berryhill? Block? Aye. Canella? De Leon? Aye. Fuller? No. Gaines? No. Galgioni? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? Jackson? Aye. Lada? Aye. Leno? Aye. Leva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? No. Morell? No. Wynn? No. Nilsson? No. Pan? Aye. Pavley? Aye. Roth? Aye. Runner? No. Stone? No. Vidak? No. Wachowski? I, Wolk. Wolk, aye.
Ayes 25, noes 11. Those amendments are laid on the table. Next, we have, my understanding is that the second set of amendments has also been withdrawn, so we will proceed to Senator Morlock's amendments. Senator Morlock, Mr. Secretary, please read.
Amendments by Senator Morlock, set 2.
Senator Morlock.
Thank you, Madam Chair. Colleagues, I rise to offer an amendment to Senate Bill 277, one that would protect and strengthen the guarantee of a good education for all of our school-age children. Like many of you, my office has been inundated by phone calls from parents who are worried about this measure. And regardless of how any of us feels about the public health benefits of vaccines, it's clear that a large portion of concerned parents will likely withhold their children from public schools because of their concerns or lack of comfort from the vaccination process. I've heard this over and over. We all want California to thrive and grow economically now and in the future. We also know that having a well-educated workforce is essential to economic success. Our students should meet and exceed the national standards on math, science, reading, and other pillars of good education. But I'm concerned that with this bill, we may be driving many school-age children away from our schools and making it more difficult for them to receive a top-quality education. Therefore, I've offered an amendment to this bill that would protect and strengthen the guarantee of a quality education for all of California's school children. This amendment simply states that those children of parents who, for whatever personal private reason, decide against the state-prescribed mix of vaccinations still have access to educational resources that our state provides for all of our students. Their parents have paid their taxes for a good education for their children. Even the Torah requires cities of refuge. Therefore, I respectfully urge my colleagues not to table this amendment, thereby continuing the long-held practice of providing quality education to all of California's school children. Thank you, Madam President.
Thank you, Senator Morlock. Senator Monning.
Thank you, Madam President. I move to lay on the table this proposed amendment.
Thank you, Mr. Secretary. Please call the roll. Senator Monning is asking for an aye vote. Senator Morlock is asking for a no vote.
Allen. Aye. Anderson. No. Bates. No. Bell. Aye. Berryhill. Block. Aye. Canella. De Leon. Aye. Fuller. No. Gaines. No. Galgiani. Aye. Hall. Aye. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Weso. Aye. Huff. Jackson.
Aye.
Aye. Lada. Aye. Leno. Aye. Leva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Aye. Morlock. No. Morrell. No. Wynn. No. Nielsen. No. Pan. Aye. Pavley. Aye. Roth. Aye. Runner. No. Stone. No. Vidak. No. Wachowski. Aye. Wolk. Wolk, aye.
Ayes 24, noes 11. Those amendments are laid on the table. The next set of amendments, number 5, Senator Anderson. Mr. Secretary, please read.
Amendments by Senator Anderson, set 3.
Senator Anderson.
Thank you. Senators, when it comes to the health of your children, every parent wants to know what their child's consuming, whether it's food or drinks. This applies to medicine as well. SB 277 fails to address the problem of fully informing and notifying parents and doctors of the contents of the vaccinations. In Judiciary Committee, when asked about the contents of the vaccines, one doctor testified incorrectly that no vaccines contained aborted fetal cells. This is important because as parents, the guardians of our children, we should have a right to know when the ingredients contained in the state-mandated vaccines violate our religious practices. For many practicing Muslims, Mormons, Catholics, evangelicals, and other faithful, this violates their personal religious beliefs. I think we all can agree that knowledge is power and empowering. This amendment simply empowers those who intend to vaccinate and those parents and guardians whose duty is to raise and protect their children. This amendment would require a doctor review the vaccine labeling and, more importantly, the contents with each parent or guardian, answering all their questions, reassuring that parent or guardian of all their concerns, alleviating those concerns. Then it requires both the doctor and the patient or the guardian to sign a form stating that the information has been shared. Look, we all know it's important for public policy. We all know it's important for parents to have that knowledge. But more importantly, it's important for doctors to know what they're doing when they treat your child. So our country was founded on religious freedom. And no one's faith should be violated without their knowledge, nor should a doctor administer a treatment without the knowledge of what it contains. Senators, I know that we like to table uncomfortable votes, that frequently we hide behind procedure, unaccountable in ways that the voters never intended. Due to the magnitude of this bill that affects millions of children throughout California, I believe that our districts, our constituents, all of Californians deserve to hear our voice vote. Please don't table this. Allow us to have an open debate. This is the people's floor. It's the Senate. Don't they deserve to hear from us? We're not asking for outrageous things. We're not saying that you shouldn't be able to vaccinate. In each one of these amendments, what we've said is, should that vaccination cost me my religious faith, do you have a right to steal my soul without my knowledge? It's that simple and that straightforward. We don't go into someone's church and raid it, but yet we're taking in the dark of night without the parents' or guardians' knowledge, their faith, and their ability to practice their faith. This issue deserves an honest and open debate. Let's not table it. Let's not hide behind procedure. Let's allow our constituents to know whether we stand for faith and the freedom of religion in California, or the Puritans were wrong when they came from England. I urge that you allow this vote to occur. Thank you.
Senator Monning.
Madam President, I move to lay on the table this proposed amendment.
All right, this is not subject to debate, as previously indicated. Is there any objection to using the prior roll call vote? Please call the roll.
Allen? Aye. Anderson? No. Bates? No. Bell? Aye. Berryhill? Block? Aye. Cannella? De Leon? Aye. Fuller? No. Gaines? No. Galgiani? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? Jackson?
Aye.
Aye. Lada? Aye. Leno? Aye. Leyva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? No. Morrell? No. Wynn? Nielsen? No. Pan? Aye. Pavley? Aye. Roth? Runner? No. Stone? No. Vidak? No. Wachowski? Aye. Wolk? Wolk aye. Roth aye.
Ayes 25, noes 10. The amendments have been laid on the table. We are now back to the bill in chief for purposes of debate and discussion. We'll start with Senator Stone.
Thank you, Madam President. My friend and colleagues on the Senate floor, as many of you know, I proudly received my doctorate in pharmacy from the University of Southern California in 1981. I've also taught graduate nursing students at Cal State Dominguez Hills Pharmacology, which is the science of how drugs work. I have spent the last 34 years as a practicing pharmacist, received additional certification to prescribe and administer immunizations. I hope that many of you see me as an expert and as a resource in my field, my true profession, where I remain a licensee by the California State Board of Pharmacy in good standing. We are very fortunate in the Senate to have two other healthcare professional colleagues in the Senate who I have a tremendous amount of respect for. The senator from West Covina and the co-author of SB 277 and the senator from Sacramento, a board-certified pediatrician.
Excuse me, Senator Stone. I recognize that we have little ones up in the gallery, but if they cannot be kept under control, I would request and ask the sergeants to require that they leave the chamber until they can come back into a state where they're not causing any chaos for us trying to listen to this important debate on the floor. So if you would please take note, parents and sergeants. Thank you.
And the co-author, thank you, Madam President, from Sacramento, a board-certified pediatrician who brings a tremendous knowledge and experience and expertise to this floor. Many of us have been in politics for some time and dread the kind of issues that divide our communities, including our state, where large groups are in favor of a bill and large groups are opposing a bill. This bill, Madam President, is such a bill. Politics divides many of us on many issues, such as taxes, regulations, the environment, and public safety, but this is not your typical bill. This bill exerts the police powers of government that many of us just don't like, and that makes many of us feel uncomfortable. It induces many of us to search for expedient political solutions. It is those police powers granted to us that we must use with great caution. During the polio era, the Supreme Court opined that requiring polio vaccinations was a legal and appropriate use of such powers. Police powers are not required in this potential law because it does not mandate that one must vaccinate their child. With this bill, it would be expedient and an easy vote for many of us just to say no. I would further like to share with you some brief facts and myths about immunizations. Facts. Measles is one of the leading causes of death among young children globally. In 2013, there were 145,700 measles deaths, about 400 deaths every day, or 16 deaths per hour. Measles is not a mild disease like chicken pox, but rather is an extremely virulent disease that remains one of the leading causes of death among young children worldwide, even though a cost-effective vaccine has been available and has been used safely over the past 40 years. Measles vaccinations resulted in a 75% drop in measles deaths between the years 2000 and 2013, preventing an estimated 16.6 million deaths. In 1980, before widespread vaccination, measles caused an estimated 2.6 million deaths each year, or 7,123 a day, or approximately 300 children per hour. Measles kills 2 out of every 1,000 people that become infected. The measles vaccine has been used for 40 years and is often incorporated with rubella and/or mumps, hence is referred to as MMR. The side effects are minimal. Redness at the injection site, severe allergic reactions is reported in about 1 out of every 1,000,000 people that are immunized. Who is at risk if you don't immunize them? Unvaccinated children are the highest risk for measles and its complications, including death, as I've elaborated on. Unvaccinated pregnant women are at risk. Immunocompromised people are at risk. People with AIDS are at risk. Those people that have had organ transplants and take immunosuppressant drugs are at risk. Cancer patients taking chemotherapy or receiving radiation are at risk. Patients taking corticosteroids for treating such things as emphysema, rheumatoid arthritis, and other severe inflammatory disease are at risk. We need 95% of the population immunized to ensure an epidemic or a pandemic does not occur. We need to do that in the United States with so many people traveling to this country that are not appropriately immunized, that instigated, if you will, the incident that we saw at a theme park in Anaheim, California. Let's be clear, my friends. This bill still allows a parent not to immunize their child for any reason. This bill, in other words, does not mandate immunizations. What this bill does do is it protects those children that go to public schools who may not be a candidate for immunizations for medical reasons. It protects them from non-immunized, unprotected children who may be a nidus for this virulent disease. The authors have accepted amendments to allow homeschooling or independent study with the support of the public schools for healthy children whose parents choose not to immunize their children. Now, here are the myths. Vaccines or vaccines that have contained the preservative thimerosal have been thought to cause autism. The MMR vaccine controversy, for all of you who don't know, started in 1998 with a fraudulent research paper by an English physician by the name of Dr. Andrew Wakefield in the very well-respected medical journal, The Lancet. In this study, Dr. Wakefield alleged a nexus of autism and the MMR vaccine. This doctor was also a paid expert witness in a lawsuit filed by a plaintiff against the manufacturer of a MMR vaccine, and he was caught manipulating the data for the benefit of his client. He was publicly admonished and had his medical license revoked, and the Lancet fully retracted his fraudulent article. This betrayal of public trust has raised legitimate concerns of many young people today who fear the high incidence of autism. 1 out of 68 children may be linked to immunizations. You can't blame them for being fearful. As a result, a new generation of young people are not getting their children immunized, placing them at great risk of morbidity and, yes, potential mortality. Following the fraudulent claims of 1998, multiple large epidemiological studies have been undertaken worldwide by many organizations that you'll recognize: the Centers for Disease Control, the American Academy of Pediatrics, the Institutes of Medicine, the United States National Academy of Sciences, the United Kingdom National Health Service, all found unanimously no link between MMR and autism. This has been called the most damaging medical hoax of the last 100 years. Let's go to thimerosal, the mercurial preservative, which was used to commonly preserve immunization so that you could put a needle in a vial repeatedly and inoculate children. Since 2003, there have been 9 Centers for Disease Control funded or conducted studies that have found no link between thimerosal-containing vaccines and autism. But just to be safe, what did the vaccination companies do? They took thimerosal out of their vaccines between 1999 and 2001, removed thimerosal, and replaced it with other preservatives. Why do parents correlate the symptoms of autism with immunizations? It's likely that this misconception persists because of the coincident timing of the beginning of the immunization process and the appearance of the first signs of autism. John F. Kennedy once said, "Let us not seek the Republican answer or the Democrat answer, but the right answer. Let us not seek the blame for the past. Let us accept our own responsibility for the future." I believe supporting SB 277 is the right answer and holds us responsible for ensuring health and safety for all of our citizens in the state of California. Among the most vulnerable are sick children attending our public schools that cannot, for medical reasons, be immunized. Thank you, Madam President, for allowing me the time to debate this very important issue. I strongly urge you to place an aye vote, SB 277. Thank you, Madam.
Thank you, Senator Stone. Senator Gaines.
Thank you, Madam President and members. I want to start with telling you that I believe in vaccinations and the great success that we've had in the total eradication, in some cases, of disease. But I also had to share with you a story that I've had. with one of my children. I've got 6 children. 5 of my 6 did just great with the vaccinations. There were no issues, no challenges. But our last daughter, Kelly, had a reaction at a couple of months of age, and she went into seizure, she turned blue, and we had to rush her to the hospital. We did an MRI, and there was an adverse reaction to her autoimmune system. And the MRI determined that the myelin, which is the coating cover over the brain, separated symmetrically. And it's called demyelination of the brain. And so we met with a pediatric endocrinologist who said, your child should not have another vaccination for 10 years. And we have slowly vaccinated her. We believe in vaccinations. But my concern with the direction that vaccinations are going in are that we're looking at adding additional vaccinations on a fairly rapid pace, and that concerns me. Because we want to make sure, at least in my view, that our children are being vaccinated for the most chronic diseases, the most deadly diseases. So we have been vaccinating her slowly, and that approach seems to be working. To me, this comes down to a parental right issue where the parent understands their children the best and in consultation with a doctor, making the right decisions in terms of what's best for their child. I also am very concerned about the religious exemption. 48 other states allow a religious exemption. So why is that being excluded in this proposal? And I was of the understanding that that would be included. So for those reasons, I am in opposition. Thank you.
Thank you, Senator Gaines. Senator Anderson.